It's a place for people who, for so long, haven't had access to the health care they need.
María, hola, ¿cómo está usted? Hola, mi nombre es Frank.
Patients like Maria Aguilar, whose healthcare experiences before finding this clinic were dismissive, superficial, and beyond disappointing.
Como que no es un humano, no es persona.
Like you're not human, like you're not a person, says Maria. It was only here at Clínica Tepati that the 53-year-old felt heard.
Sí, mi experiencia aquí ha sido muy buena.
Translating is volunteer Alex Pulido. For him, the work is personal.
When I'm working with these patients, I see my parents.
The majority of patients he sees are Spanish-speaking, like them. And between the language barrier and lack of insurance coverage, many have fallen through the cracks of the U.S. medical system.
It's one of the biggest motivators that we have as undergraduates to kind of join the clinic and be involved in the patient care.
An undergraduate studying pre-med, Alex is a member of Clínica Tepati's all-volunteer student workforce, many of whom come from Spanish-speaking households themselves. Since 1974, Clínica Tepati has been committed to providing culturally competent care through health screenings, education, and patient advocacy. The student volunteers are here to learn and gain valuable clinical experience while providing free care to an underserved community. Dr. Jose Arevalo was a leader here, the instructor of record at Clínica Tepati for 16 years. He's also the founder of the Sacramento Latino Medical Association, a nonprofit established in 2007 to connect Latino physicians and advocate for Latino healthcare. SALMA supports Latino students pursuing careers in healthcare, including those at Clínica Tepati, which Dr. Arevalo says is crucial.
We have such a huge population of Latinos, Latinx, and particularly the underserved population, and yet we have very few doctors that are available to serve that population, and we've got to do something about it.
In California, Latinos make up 39% of the population, yet only 6.4% of physicians are Latino. And representation is important, whether it's about language access or a culturally competent approach. According to a 2023 California Health Policy Survey, 70% of Latinos said the health system regularly or occasionally treats people unfairly based on their race or ethnic background. Dr. Arevalo says Clínica Tepati has helped shape the next generation of medical professionals that this population can trust.
And trust happens a lot easier when it's somebody that looks like you, talks like you, came from the same background and environment because they've walked a mile in your shoes.
According to the 2022 California Health Interview Survey, 8.4% of Latino adults are also uninsured. By comparison, just 3.1% of adults who are not of Latino origin are uninsured. And on top of that, more than 22% of Latino adults report not having a usual place to go when sick or in need of health advice.
Some of these patients, are kind of faced with the tough issue, should I go to the emergency department or should I go to urgent care when they don't have a primary care kind of provider that can provide these services for them.
Frank Sierra spent several years caring for his grandfather near the end of his life, before medical school and before becoming the student chairperson of Clínica Tepati.
And attending a lot of these appointments and seeing that there was a lack of Spanish-speaking healthcare providers is something that really inspired me to not only want to serve as a translator, but also kind of be the provider for patients like my grandfather.
Like the other student volunteers at Clínica Tepati, Frank is gaining valuable hands-on experience that will serve him well as a doctor, while at the same time giving voice to patients like Maria, like Frank's grandfather.
Even though he's not here, I do know he's proud and, especially of the type of work that I hope to do as a future physician to really impact these communities that are otherwise overlooked.
Making an impact on an overlooked community and building trust.
More than just medical care, it's treating people like people and building a connection with them to build trust, right? Essentially is what's the end goal, right?
It's been Clínica Tepati's mission for 50 years. Treating people today and training the doctors of tomorrow. In Sacramento, Luke Clary, ABC 10.